What made you pick gynecologic oncology? Out of all the things you could have done, what made you go that route?
I love to do surgery, so it was GYN oncology was a combination of surgery and medicine in a way that allowed you to communicate with the patients, follow the patients in a longitudinal way, and be closer to the patients than just surgery where you operate and then you don't see them again.
Yes. So like you were my surgeon and my doctor.
I hope so. Yes, that was the idea.
Yes.
I mean, the subspecialty of GYN oncology is interesting because it started 40, 50 years ago so that patients could have sort of primary oncology, if you will, where they could go to one person and they could do their surgery and then they could be with that person to do their chemotherapy. And we used to have a major role in radiation therapy as well back then. So it was meant to center the needs of the patient in one area with one physician or one practice.
Which obviously is beneficial for the patient. And there's not that many of you, right? In the United States, aren't you like kind of a rare specialty?
It's a small subspecialty of OBGYN. There's somewhere around 1,300 GYN oncologists in the country.
Wow.
So still pretty small.
Yeah. We're lucky enough to have 3 gynecologic oncologists here at Zimmer. And my understanding is that multiple studies indicate that if a woman is treated by a gynecologic oncologist when she has a gynecological malignancy, that she has a greater chance at survivorship. Could you explain to me if you find that to be true, and if you could explain to me why that is so key?
Gynecologic oncologists have specialty training in treating female cancers. We learn in more depth how to properly take care of the patients with GYN malignancies, and that extends not only into the treatment of chemotherapy and the combination of chemotherapy and radiation therapy, but the surgery is different that we do on patients that have GYN cancers as opposed to normal OBGYN physicians and the type of surgery that they do for women in a general practice. So the need for surgical staging and accuracy of staging and the extent of surgery really is what makes the difference for most of those patients in terms of their survival. Being a small subspecialty, we can concentrate in depth in women's cancers as opposed to medical oncologists that really need to treat a lot of different cancers.
You don't just treat ovarian cancer, you treat all gynecologic cancers. So that includes what specific types?
The majority of GYN oncologists just treat the reproductive system sort of below the waist, if you will. So cervical cancer, uterine cancer, ovarian cancer, fallopian tube, vaginal cancer, and vulvar cancer. So those are the main areas.
So which one would you say out of all those is the most challenging to treat?
Honestly, I think that ovarian cancer is probably the most challenging. The ovarian cancer is harder to diagnose and also harder to cure. So most women that get diagnosed with ovarian cancer will ultimately die of their disease. So it's trying to optimize a patient's chance of doing well with that diagnosis.
Okay.
And that's what's tough, I think.
Yes, it's quite tough.
What it is, and what changed over the years since I've been in practice is that women that have ovarian cancer, diagnosed with ovarian cancer, used to have poor outcomes, but we didn't have much treatment either. So we kind of accepted the fact that, we did what we could up front, but, ultimately that wasn't going to work out for a long period of time for those patients. Mm-hmm. Now, however, we have far more chemotherapy agents to use and different surgical approaches to use that have really extended the life expectancy of women that are diagnosed with ovarian cancer. And the goal is to extend the patient's life and extend that life with good quality of life. Mm-hmm. And that we've been able to do that, but mortality is still high. It's just that they live longer and have a better quality of life for the time that we've extended their lives.
So there's been kind of a shift to like a chronic disease situation, sort of like my situation.
Yes, I mean that's what a lot of people looking at ovarian cancer like. I mean, to see a patient live for 10 to 15 years or longer with an advanced stage ovarian cancer diagnosis is not uncommon anymore. Where it was very unlikely that someone was going to live more than 5 years 30 years ago.
Yeah. So that's like probably one of the bigger changes you've seen throughout your career then, huh?
It really is. It really is. And the quality of life of the patients is far better during treatment and after treatment.